Hey, this is Dr. Keith Hersey, and you are listening to the Destroying Diabetes podcast. Good afternoon, everyone. Good day, wherever you're listening from. This is Dr. Keith once again. I'm glad that you took some time out of your busy day to listen to this podcast. I appreciate all the support that I get. Keep coming with the emails. Like I said, I'm still looking for that first international email. I haven't gotten one yet. I've been trying to solicit to see if anybody's listening outside the United States, but so far I haven't gotten one yet. But so thank you again and appreciate all the support. Want you to continue to support our podcast. If you subscribe, that's the best thing that you could do for us. Promote it among your network, your circles. We really appreciate that. And also just like and share the podcast to anybody. What this podcast is, it's about giving information, particularly about diabetes. And so we want to spread the word as much as possible. So anything you can do to help promote us, really appreciate it. Keep the emails coming. Keep the all the information coming to me. And like I said, I read all the emails. I don't have a staff or whatever to read it. So if you send an email, I will be the one reading and responding to it. So again, like I said, I'm so thankful that we have plenty of guests that agree to come on and share knowledge. I'm particularly excited today because I have Dr. Rachel Goode. She is a professor, assistant professor over at UNC Chapel Hill, the real UNC, like I say. I know. That's okay. I have a lot of friends at State, and
Okay,
I worked at Duke for 20 years. So,
got it,
um,
got it.
I got all the bases covered. And my wife is a graduate alumni from State,
Okay.
so I got all the bases covered. And and I said she is a assistant professor over at UC Chapel Hill. She has received multiple degrees from the University of Pittsburgh. So I'm sure she's a great Pittsburgh Panthers fan. And also that she has done a lot of work in the community. The reason I have her on today is because particularly a subject that's not talked about a whole lot that she has been looking into, such as the link of the rise of type 2 diabetes, especially in younger people and young women in particular. And I think that's a very important topic because that is a disturbing trend that we're seeing in the healthcare field. And the more education, the more that we study and why it's going on, that we can address the problem. We already have uh, too many people in this country with type 2 diabetes, and we don't want to inadvertently add on to those numbers. So I'll have Dr. Goode, if you want to introduce yourself briefly and just tell a little bit about the work that you're doing, particularly with type 2 diabetes.
Oh, thank you, Dr. Keith. I am so grateful to be here with you all. So my name is Rachel, and I am a researcher who studies disordered eating and chronic disease. So, in particular, my lab and I, we have been investigating eating disorders and how they might be showing up around folks who are navigating type 2 diabetes, obesity, particularly in Black Americans. And now we're looking at young adults and trying to understand what are some of the factors that might be related to even they may not have type 2 diabetes yet, but what are they doing now at age 18, between 18 and 25, that will get them on the pathway to getting diabetes later in life. I'm grateful just for the opportunity to chat, and I'm looking forward to our discussion.
Okay, well, again, thank you very much for agreeing to come. And I think this information is just is great to be available. And then we know that that type 2 diabetes has been increasing among all populations. And then especially I know in your field that you are looking at young people, particularly younger African American women. Um, why do you think so far, or from what you've seen, why this demographic it seems to be so vulnerable to this developing condition?
That's a great question, and it's layered. It's layered. I think one thing that we are learning, part of it is genetic, and we are and how our bodies tend to respond to this environment. Another thing that we are seeing, again, we pick up the social determinants of health and how, especially those who are navigating, more. Um, Challenges related to those might be more likely to experience type 2 diabetes and be diagnosed. They may not have the access to the exercise environments, the fresh food. Also, what we're learning in my lab that I think one of the under talked about reasons is how we learn to regulate our emotions at a young age. And again, I think particularly for Black Americans, when it comes to emotions, that's been a liability for us, right? We really haven't had permission to have healthy coping skills, ways to deal with that. So we've had to figure it out the best we could. And I know one thing that I learned as a young child, and I know many of my other brothers and sisters have learned, is how to cope with food and how to use food. And this environment with the combination of so many foods that have all these toxic products, the high sugar. If we have learned to cope with food and then we have an environment that has created a reward system and almost makes you more addicted, it can be a very, very nasty combination that has created a pathway, I think, for people to consume more and more food, to gain more and more weight, and then kind of get overwhelmed and not be able to have the tools to come out and really know how to resist type 2 diabetes in a tangible and a realistic way.
Oh yeah, yeah, and you mentioned just the way you said with the social determinants of health. Um, and could you explain a little further about how that all wraps together when you have that inequality, neighborhood environments, and then even like cultural stigmas that affect the Black community?
Yeah, for sure. So when we think about how people's health is and the ability to obtain your best health, we have learned over the years that there are certain systemic things in place that even more than your individual behavior are going to impact it. So one, in the United States, we think about racism. And racism has created redlining, where people are certain communities where they have historically may have had access to and others have not had access to. It has created inequality in our education system, inequality in our economic mobility, inequality in access to healthcare. It is an inequality in neighborhood environments and the resources that are present within those environments. And so when we take two people and recognize that as they both are trying to manage their health, when we recognize that if one is more susceptible to experiencing some of those social determinants in negative manner, their health is impacted. And again, we're not even talking about any individual behavior, but if you are in a neighborhood that doesn't have access to fresh grocery stores, you are in an environment with negative economic mobility, you may not have access to the foods, you may not have access to the doctors, the resources that you need to really have the tools to put your health first. And we're not even talking about the stress, right? The stress that living in these environments people are facing. I mean, the chronic stress, and we know how stress influences, glycemic control and insulin resistance, and how just again, I'm waking up and I'm stressed, right?
Yeah,
Just before
yeah,
our day has even gotten started,
yeah,
and
yeah.
how that has impacted folks as they are really trying to navigate this environment that can be very, very merciless to them.
Yeah, yeah, it definitely is. It is just extreme issue that all these things are. kind of work together in a negative thing, negative
Mm,
pattern, and it's just like like you said, it's multi-layered. It's not just one thing. It's not just,
right,
well, if we fix one thing, everything will work itself out. That
right,
you have multiple layers, and we know that we have many parts in this country in urban areas where there are like food deserts, where it's not no limit or no access to healthy food. So even if you wanted to do that, it makes
yes,
it difficult because you don't even have access to even try
right,
to do it. Then it seems like that we just need to make more of an effort to get the healthy foods I mean, into the communities that don't have access to them. Because I
exactly.
mean, a lot of the big problem, it's hard to tell somebody, well, if you're fortunate enough to see a healthcare provider and they say, well, you need to change your diet and you need to eat more fruits and vegetables and less processed food, it's like, where am I get it from? The
Where am
only
I
thing
gonna get
around
it?
me, yeah, the only thing around me is a McDonald's.
Mm.
That's in, walking or the bus distance, close
That
by.
part. Yeah, and Dr. Keith, we also need to talk about the food swamps, right? So if all I have access to these fast food restaurants, these processed foods, it changes your taste buds. So you don't even like the other stuff, right? It don't taste the
Yeah,
same as it, and on purpose, on purpose. And
yeah,
so yeah, and when you are eating things with high sugar, high salt content, like you're not the other food you're just like it just
yeah,
doesn't hit the same. You don't even
yeah,
desire it in the same way, which makes it even harder for folks to get what they need.
yeah, yeah. And then, and I'm now sure that you're seeing this too in your studies that not only the access in the neighborhood, but then also in a lot of unfortunately, a lot of with the school lunches that they don't have access to healthier food. So that taste buds, like I said, never even experience those,
Yeah,
healthier foods and stuff. I mean, they're
exactly.
basically fed
Never.
nonstop, processed food. And
Yes.
and then if you that's all you eat, and then someone puts some carrots in your thing, you're like, what is this? Or
What is this? You don't want it?
the spinach, you're like, "Ugh, that tastes like French
Exactly.
fries, and
Right. Exactly.
it doesn't taste like Doritos or whatever and stuff.
Mm-mm.
So,
Flaming hot. That's my son. He
oh
likes
yeah,
flaming
oh
hot.
yeah, oh yeah, oh yeah. My son is a Cheetos person, so.
Yeah. Yes.
But we really have it an issue with that. And then also I think that was really fascinating with your work is that unfortunately finding that the link with young women and young Black women and eating disorders and how that can also play a role in that. Did you want to talk about that for a moment?
Sure. Yeah, we've had the opportunity, the blessing to spend time interviewing Black adults who are navigating type 2 diabetes, predominantly women, those who say they struggle with binge eating, meaning they cannot stop eating certain foods or certain at certain times if they want to. It's almost like they feel out of control. They feel compelled to eat. And so what we're learning from these participants is that often when they get their diagnosis of type 2 diabetes, for many years beforehand, they have been emotionally eating. They have been using food to cope, in addition to the impact of the social ecological environment. And they often might feel like they have to restrict. Once they get type 2 diabetes, they have to start restricting their eating. And then they feel that desire to eat. And it might lead them, that restriction might lead to a natural reaction in the body because the deprivation is present. And then they end up having binge eating. And so after a while, they're exhausted. Right. We talked to people who had had type 2 diabetes for, between like 3 and 7 years, and they're tired of the challenges of day-to-day management of trying to keep their blood sugar in the right spot, and it's been hard for them, and so it makes us think about what do we need to do for intervention? What can we do to help? How can we support this population better so that they can have the tools needed to manage their type 2 diabetes and even prevent it?
Yeah, yeah, yeah. So yeah, it's definitely a huge issue, and there's is now it's estimated almost 1 in 3 adults may be in a pre-diabetic stage and not
Mm,
not aware of it,
not aware.
and that's just amazing. Well, it's not amazing because I mean, I was probably before I was diagnosed 20 years ago. I was probably in that 1 to 3 class. I
Yeah.
don't know if you're familiar with. I've said the story many times of how I discovered being diabetic. I was at a pharmacy conference, and there was a vendor that was displaying. I guess like they had new blood glucose monitors, so they were had it on display, and they were inviting people just to get their blood glucose checked, just to show what their machine could do. And so I went over and got it checked, and my blood glucose sugar was like through the roof. And
Oh my
of course they
goodness.
said, and then I tried to rationalize it. Well, I said, well, we just had like a big lunch over there, and whatever. And the vendor was like, you're like, this is bigger than a big lunch or whatever. You might need to see your doctor or whatever.
Wow.
So, and that's what started me on the path of that. And it's easy to do, to be in denial, like I said. And then if you're caught in trying to survive, just trying to
How
work,
about
just
that?
trying to stress, just trying to make it day to day, it's easy to, look over because a lot of the symptoms may be subtle. You may not make a big deal about the frequent urination or the frequent
Yes.
thirst because you're busy just trying to make it, and you may overlook that. So we just have to find better ways of encouraging people to pay attention to some of the early signs. So like I said, so maybe we can catch people before they get into type 2 diabetes, or they
Yes.
may have it and we may be able to mitigate it, with lifestyle changes. And that's what I'm focusing on doing now. I mean, I have a program, and of course in the program would be also in the show notes, that really attacks um, being able to, especially with pre-diabetes from going into diabetes. It's modeled after the Asheville Project. So it's a great thing that I work with someone that helped develop it, and now I'm helping to work with it and get as many people on it as possible, because I think it's just like it's a real game changer. It really keeps people help you get accountable, and gives you kind of like the tools that you need to kind of manage it. So
Mm, that's wonderful. I mean, that's really what, oh, I mean, I would love a world where less of us are getting type 2
yeah.
diabetes, but we recognize so many right now are impacted and need tools that will help them and help them. So I love that you're doing that, Dr. Keith.
Yeah, yeah, yeah. And like I said, and then I just love like just the research in the area that you're working at, because I think it's kind of like like a underlooked, element, because people know about the stats, and they know about the estimates of how much of our population has in various stages of type 2 diabetes, but nobody goes into the why or how, to try to attack it. And I love that your research is shining a light on that. And I hope that, it can develop into more productive and useful policies. People can use that going forward, as we try to, manage and craft our healthcare system for the 21st century.
Oh my goodness. Yes, it is quite a challenge that life, but we are excited and hopeful, right? That we are going to be able to learn more and be a tool to help.
Okay, and then also I know that you working with us a study ongoing. I don't know if you still are soliciting people to participate in the study.
Dr. Keith, yes. So we are doing a study right now with Black adults in the Charlotte Mecklenburg region. So if you live in Charlotte, North Carolina, or within, 60 miles and can get to us twice in person, then we are running an opportunity for you to get support managing your type 2 diabetes. We're looking for adults who are struggling with binge and emotional eating. So feeling, again, if you feel like you get out of control around food, and you might find yourself eating late at night by yourself, feel like you can't stop eating even though you would want to, we are looking for you. And so this program, no cost to you, and we are wanting to learn more. So it's a group program, and we have coaches, facilitators who are there to support. And yeah, so we are welcome. And I will put can I put the address in the chat? Would that
Yes.
be helpful to the website that can give
Yeah.
out more information
Okay.
about the study and
Okay.
how to sign up?
Yes, and then also we'll have that link also in the show notes. So if you're just looking at it or listening to us um on your computer or your phone or whatever stuff, so it will also be in the show notes as well. So I really encourage people to get into the studies. One of the things and one of the downfalls in the past of like studies and clinical trials is that African Americans don't participate in a rate that they are in the population. So sometimes you may not get a full view of whatever that they're looking at or testing reflective of the general population. So it's really important for us to get into these studies so that they'll have the data will be more accurate and will reflect our experiences and any of our cultural effects and when people are coming to conclusions about studies. So it's so important for us to get in all these different studies and participate.
Yes, yes. So that's key. Yes, we need you. And so I love that you said that. I agree.
All right. Thank you so much. Well, I would like to give you the floor for the last minute if you want to kind of summarize about your work and the need for help and anything else you want to let our audience know.
Yeah, so you all can find me and my lab. We're at livingfreelab.org. You can find us on Instagram at livingfreelab, and you can learn more about our science, our studies. If you're thinking about participating, we are located in North Carolina, but we are looking forward to making friends all over and just to be able to be part of a solution to help folks either A, prevent type 2 diabetes, B, better manage, and learn how to listen and adhere to your biological signals of hunger and fullness. I know that's something that culturally we have kind of gotten out of the habit of doing, but to help people have the tools, right? To relearn, reconnect. And we are seeing success in our studies when people have learned these tools, it helps them prevent weight gain, reduce binge eating. And now we are trying to see what that does for folks who are navigating type 2 diabetes.
Hey. All right. Well, thank you so much. And as you heard Dr. Good say, we really would appreciate your participation and just follow her in her lab with the work that they're doing. It's outstanding work. I'm always going to keep up with it because I just love the work that she's doing. It's so important. And anytime I get a chance to lift up your work, I will definitely do it. And I will encourage anybody that knows me. You need to check Dr. Good out and the work that she's doing. Even if you don't have
Thank you.
type 2 diabetes, I'm sure most people have friends and family that do. Um, and people that can benefit from it. So just let create awareness. Like we just want to, like I said, get as many people into these studies and looked at so that we can get a true reflection of what's going on out there. And so policies develop off of studies such as this. So, a lot of times if you want to make change, you have to have the data to present to people that can make changes. So it's
Yeah,
important
so
for us to
true.
do that.
So true. Thank you, Dr. Keith. I appreciate your support.
Oh yeah, anytime, anytime. And thank you so much, Dr. Good, for coming on our podcast today, and wish you continued success. And we would love to have you back on at a future point. If you ever need us to help spread the word about anything that you're doing, just let me know, and I'll have you on. I have you.
Okay, look, that sounds good.
All right. Thank you so much. I
Okay,
really
thank
appreciate it.
you.
All right.
Okay,
Uh,
talk to you later.
bye. Okay. Thank you, Dr. Good, for coming on today, and really appreciate it. This is someone that you really need to follow. Her lab is on social media. We will put links to the study and also the links to her social media as well for you to follow and keep up with. And again, thank you for taking your time out to listen to our podcast or watch it, whichever way that you do it. You can do either way. We're on YouTube, Destroying Diabetes. We're also on anywhere that you can listen to a podcast. Anywhere you have an internet connection, you can listen or watch us. So we appreciate the support. Feel free, if you have any questions about anything that we talk about on the podcast, or you have any questions for any of our guests, please email me. The email is located in the show notes. And if you have any questions in particular about what Dr. Good and what she's working with, just send them to me and I'll pass them along to her, and she can respond to any questions that you have about any of the programs that she's looking at or any of the studies that she's conducting. All right. Thank you so much again for spending part of your day to listen to me. Like I said, they didn't lock the doors, so they let me in, and hopefully they won't lock the doors next time. So I want you to continue to be well and be blessed.
Thank you for joining us on this informative journey. The content of this podcast is solely the professional opinion of the host for informational purposes only. It should not be considered a substitute for professional medical advice, diagnosis, or treatment. If you're experiencing any health issues or concerns, we strongly recommend that you seek the counsel of a qualified healthcare provider before making any changes.